Organization headquarters in Geneva, and I will be your moderator for this session. So we still have a few people filing in. I might just wait another 30 seconds or so because I can see that the numbers are increasing. Okay, I think we're starting to stabilize. So I might introduce myself again as we've had quite a few more people join. My name is Amy Savage and I work in the Climate Change and Health Unit at the World Health Organization headquarters in Geneva, and I will be your moderator for this session. So I'm really pleased to welcome you to the 7th session of this 11-session course, Scaling Up Health Adaptation Measures to Meet the Climate Change Challenge in the Americas. The topic today is different countries, different challenges. What can we learn from others? Now, I'm sure you've been learning a lot over the last 6 sessions, and we have a really interesting one today. But first, we'll do a little bit of housekeeping. So as always, we have simultaneous interpretation in English, Spanish, French, and Portuguese. So if you would like to use the interpretation, please select the little world icon that you can see on the slide here and in your Zoom and select your language. As mentioned, we're already up to session 7 today. So far, we've looked at why we need to scale up health adaptation and what are some of the approaches. In the last session, I think it was on Tuesday, we discussed some of the challenges in communicating our efforts in scaling up. And today we're going to build on some of this and talk a little bit more about contextual differences and how we can learn from others, how we can learn from each other, and how we can use some of the approaches and lessons of other contexts and adapt them to the specific and often quite unique circumstances of our own context. So this is just a brief reminder of the overall course objectives. I won't go into these in detail as we have a very full session today, but it is useful to keep these in mind as you progress through the course. And this session today is built around the following 4 learning objectives you can see on the slide. So we'll be looking at how different governance structures affect the scaling up of health adaptation and thinking about how that applies in your context. And as I mentioned, we'll be looking at how approaches can be adapted to varying contexts. We'll also consider how we can use global networks and platforms such as the ATTACH, the Alliance for Transformative Action on Climate and Health, to support scaling up and crucially using these platforms to learn from each other. And finally, we'll be thinking a bit about how we can design collaboration mechanisms or better use the ones that we already have. And just a few logistics. So the session will follow a similar format to many of the other sessions. We'll have 90 minutes and then we'll have a Q&A after the presentations. So please do enter your questions for the presenters in the Q&A box as we go along, and we'll be monitoring these to make sure we can get right into them after the presentations. As always, the session materials and recording will be available on the course website. And as we're nearing the end of the course, just a little reminder that you will need to attend 8 or more live sessions to receive the certificate of participation. Now, your attendance is automatically counted on Zoom, but it will only be attributed to you if you've joined using your own personal Zoom link. So it won't count if you've joined with a colleague's link. And also you must be joining via Zoom and not just watching the recording on YouTube. In addition to the attendance requirement, there will also be a final exam and a score of 70% is needed for the certificate to be awarded. If you haven't yet, please join the WhatsApp group for some really interesting discussions. And now we'll get straight on to the interesting stuff. So today we have 4 incredible presenters and you can see all of them on this slide. I will introduce each of them right before their presentation. So first, I am pleased to introduce Dr. Diarmaid Campbell-Landrum. Dr. Campbell-Landrum is the head of the Climate Change and Health Unit at the World Health Organization. Over the last 20 years, Diarmaid has played key roles in developing the first quantitative estimates of the overall health impacts of climate change, resolutions of the World Health Assembly, 4 WHO global conferences, and the expansion of WHO's program on health and climate, which has now supported over 30 low and middle income countries. He's an international member of the US National Academy of Medicine and a lead author on several Intergovernmental Panel on Climate Change, IPCC reports. So I'm very pleased to hand over to Dr. Diarmaid Campbell-Landrum.
Thank you so much, Amy. It's a real pleasure to join you. So, bonjour, hello, buenas tardes, boa tarde to everybody. And what I will be doing within hopefully 20 minutes or so is to quickly run through our perspective from the World Health Organization on exactly this question of how different countries and different situations vary in how they are threatened by climate change in health terms and how they respond. But more importantly, how we can work together and learn lessons from each other in order to mount the global response, the collective response that we all need to meet this huge challenge. And the way I'd like to start this off is just to emphasize why it is important to take account of those different contexts from around the world. And this is a very crude illustration of that. And as Amy made clear in the introduction, it actually made me feel quite old. I've been working on this issue now for more than a couple of decades, but one of the first jobs that I did for the World Health Organization was to work on the bottom part of this graph, which is to try and estimate the health impacts, the overall health impacts of climate change and we published that the first round about 25 years ago. And the overall crude conclusion that we reached was that climate change was already exacerbating some of the biggest public health challenges that we face and continue to face. So things like malnutrition, infectious disease, including vector-borne disease, diarrhea, and so on. Also, heat stress, the impacts of extreme weather events. So the most vulnerable populations were those that already suffered the greatest burden of those diseases. And that is shown on the bottom part of the graph. But of course, this is not where most of the climate change problem has come from to date. It has mainly come from parts of the world, such as the one that I come from and I sit in Europe, North America, and so on, basically the richer countries of the world who accidentally have been mainly responsible for emissions of greenhouse gases to date. But you can see that at the very crude level, they're almost the inverse of one another. It's those populations which have contributed least to climate change which are most vulnerable to the health impacts of climate change. And you can tell the same story within countries, within societies as well. It tends to be poorer populations, younger populations, which are most vulnerable, which have contributed at least to the problem. So that's partly why we need to treat this as a global issue, but also to take into account the very different contexts in which this challenge has to be met. Because as you can see, if you superimpose those maps, there is that great difference. I am conscious that I'm talking to an audience which is, I see, mainly but not exclusively coming from the Americas region. And I would say these estimates are both quite old and very crude. We do recognize that particularly amongst the more vulnerable populations in the Caribbean, Latin America, and so on, there are high burdens, high impacts of climate change. But I use these slides mainly just to illustrate that general point of the differentiation that we need to recognize between countries, between populations, including those within countries. In addressing this both as a global challenge, but one that also needs to be context specific, I think we should recognize the progress that countries have made over the last couple of decades since this issue started to be illustrated as a major public health challenge. And we're now at the point that through the World Health Assembly and also reflected in the Directing Council of PAHO, climate change is recognized as one of the great threats that we face. And in basically the global health agenda for the next 5 years, general program of work for WHO, but that's WHO, the member states, as well as the Secretariat. Climate change has been identified as the first of only 6 strategic priorities. So it really has been highlighted as a really important issue. And countries have agreed that the health agenda on this needs to address adaptation. And I think most of the attention, rightly, is focused on adaptation, making populations more resilient to the health impacts of climate change. But that agenda also recognizes that there is a job for mitigation within the health sector, and also the role of the health sector, or the health community, the health arguments, the health evidence in promoting more sustainable and healthy practice in other sectors as well. But I do recognize that this seminar, this series is mainly on the adaptation side, and that is also basically how the health community, I would say, puts as its top priority within the climate change and health agenda. And that has been further reinforced by a World Health Assembly resolution last year, and then a global action plan on climate change and health, which was passed through the World Health Assembly in May of this year. So we basically now have very strong global mandates to elevate the issue of climate change within the global health agenda. We also, I would say, due to work that we've been involved with many partners from around the world, have, we think, now quite solid frameworks for how we should be supporting countries to make their health systems more resilient to the health impacts of climate change, and also take into account that sustainability aspect, which we also think is an important part of the agenda now. So we've published this operational framework for the first time a decade ago now, but it's recently been updated to include that resilience component. And so this is the general model that we think can be applied to pretty much any health system in the world to a greater or lesser extent. But at the same time as having general models that we think can help countries to navigate, to map out the scope of things that need to be done within health systems, once again, we absolutely recognize the difference between countries and the difference between populations. And the way in which we represent that is to take into account those 2 dimensions, one of health system performance, including health system resilience. We have this shown here on the vertical axis, but also that measure of sustainability or low carbon health systems as that we're trying to achieve on the horizontal axis. Each of the dots on this slide is a country, and these are real data. These are the representation of these countries, and you can see there must be a different story for each of those dots, because we're basically trying to ensure that all countries, all health systems are in the top left-hand corner. So as a first priority, that they're high-performing health systems that provide excellent, equitable, universal health coverage that's also resilient to climate change. So we want every country to be high up on the vertical axis. And at the same time, we want countries to either stay or move back to the left-hand side of the graph. And there is a different story to be told if you're a very poor population with a relatively weak health system, which is not emitting much carbon because you may not even have energy access in your healthcare facilities. So you're in the bottom left-hand part of the graph, and we want to support countries to move vertically upwards. And that's a different story than if you're in the top right-hand part of the graph, where you may be already providing very good health services, maybe now challenged by the climate challenges, but we would also want to work with countries to ensure they can move back to the left-hand side of the graph and improve their sustainability. So this is one of the points I wanted to make about the learning or recognizing the differences between different countries. We now have from WHO a long-standing program of support on climate change and health, and your moderator, Amy, is one of the key people in our team rolling out the technical support, access to finance, and so on that WHO is working with countries in order to support them to achieve what I've just described. And this has moved quite a lot, I would say, over the last decade or so, as we've started to run country projects on climate change and health. So we now have a lot of quite rich experience from across different countries, and I'll touch on a little bit of that towards the end of this presentation. At the same time as we've elevated collectively climate change within the health agenda, we've also been working very hard to ensure that health is better represented within the climate change agenda as well. And I would say that one of the big boosts that we were able to achieve in partnership initially with the UK presidency of COP26 at the end of 2021 was to get the first ever commitments by countries to work towards climate resilient and more sustainable health systems. And at that time, we were able to get 50 countries to sign up. As of this week, I think we have now got 100th country to sign up to those commitments. And we have established in June of 2022 the Alliance for Transformative Action on Climate and Health, which is the collection of those countries and now almost 100 development partners in order to work together to support countries to achieve those commitments, because we didn't want to be in the business of just asking countries to commit and then leaving them on their own to sort out their own problems. The attach is set up in order for us to, as with our member states and ourselves and other partners, in order to pool our expertise and resources to address this common but differentiated challenge. But you can also see other major milestones on this timeline through which it's been possible to elevate the position of health within the climate change agenda. And that will move again further next month at COP30 in Belém under the Brazilian presidency, which will see the launch of the Belém Health Action Plan, which focuses particularly on the adaptation part of the agenda. And I won't really talk about that. I understand that's already been covered by our colleague Agnes Suarez in a previous presentation, but it fits into a longer context, a longer story. And just to say a few more words about the ATTACH, the Alliance for Transformative Action on Climate and Health. I think many of the people on this webinar may well be familiar with this, but the roles of the ATTACH, the functions that the ATTACH supports, are about raising the prominence of this issue. It's particularly about sharing expertise, knowledge, best practices, and so on, promoting alignment and coherence. So ensuring, for example, that the agenda that is agreed at the World Health Assembly is aligned with and compatible with the Belém Health Action Plan, which is then taken to COP30. We also want to monitor and track progress, and a lot of progress is being made. And a particularly important issue that many countries are facing is in access to finance. And the ATTACH works together to try and facilitate that access, because it has been a neglected issue that has fallen between the cracks of health financing and climate financing. And we're working to address that now. And just to highlight one of the mechanisms through which we do this is the ATTACH community of practice. You can scan the QR code, you can go to the website, and there is now a wealth of resources contributed by technical agencies such as ourselves or the other partner technical agencies, but increasingly case studies of best practice that are actually being advanced by the countries themselves. And just to also emphasize that point about coherence, we have worked very closely with successive COP presidencies, including, I would say, a really fruitful partnership with the current or the incoming presidency of COP30, the Brazilian presidency. And in July of this year, along with our colleagues in PAHO and the Brazilian government, we co-hosted what is our fourth, I think, global conference on climate change and health, which advanced work and discussions on the ATTACH, but also basically collated inputs into the Belém Health Action Plan, which will now be launched at COP30. And then just to talk through a little bit around the functions that we see as the kinds of things that countries will need support, or we know they need support. They come to us for support in achieving. What we have tried to do from the WHO perspective is, rather than just publishing technical documents and sending them to people, to try and address the kinds of questions that we are hearing back from countries. So they say we need to assess the challenge that we have. We need to develop a plan. We need to access finance to implement that plan. We need to implement it, and we need to monitor it. So we've tried to group our technical resources into toolkits that address each of those questions in turn. And just to give a little bit of an illustration of the progress that we're really seeing over the past few years, one of the things that we track, we both support and track, is progress in developing health adaptation plans. So these can be standalone health adaptation plans, or they can be the health component of an overall national adaptation plan, a cross-sectional adaptation plan. But we consider, and we're supported by countries in this, that a good plan should cover the kinds of functions that are described in that image on the left-hand side. And we're tracking the extent to which countries are or are not including these different functions within those capacities. And as I say, we've seen a lot of progress, and we can also pick up where the progress so far has been weaker. So we see a lot of progress on governance, on assessments, on capacity building, not as much coverage so far in the plans on the actual implementation side. And so that's where we know we now need to focus our effort. But just to give some case study examples of these different functions actually from the field, from individual countries, one of the things that came out of the conference in Brasilia in July was basically to elucidate from countries their best practice in addressing these issues, and there was a wealth of information that came forward directly from the field, directly from practitioners who were working in these challenges, and to us are the reality check on whether our technical guidance and support and so on is addressing the kinds of issues that they're actually facing. And so to take that planning aspect, I won't try and read everything on the slide, but we have countries such as Lao, PDR, who have set up a very good leadership and coordination mechanism with a very strong role for the Ministry of Health, but also working with other ministers, other ministries, other partners, and so on, increasing capacity within their own staff, and also ensuring that health is well represented within those planning documents and the commitments that governments are putting together to address the climate change challenge as a whole. So to ensure that health is not left behind in comparison to water and sanitation or food and agriculture and so on, that health has its rightful place at the table as one of the major issues within the response to climate change. We also, have good case studies and opportunities now in terms of accessing finance. This is just a very timely example that we have from WHO, where we, along with the UN Development Programme, have just submitted an invited proposal for a co-investment facility from funded initially by the Green Climate Fund in order to support the coordination of financial inputs from climate finance, from health finance, from national resources, in order to support the implementation of those country-driven plans that the countries are now really taking ownership of. So we do have progress, we do have opportunities in meeting some of these challenges that countries have identified. I've talked a little bit about the planning function, about the access to finance function. The most important part of this, of course, is the actual implementation. And here, again, we see more progress first on the on the assessment side, on governance and so on. But we also see a good number of countries now actually making progress in the practical interventions that they need in order to provide protection to their populations. So some of the common features that countries want supported are things like a focus on healthcare facilities or the capacity building of the health profession or climate-informed surveillance and early warning systems is a very common request from countries. So we see movement there across a good number of countries above and beyond just the pilot projects that we've been supporting over the past 10 or 15 years. And in order to further drive forward that progress, we are also, through the attach, basically accumulating those best practice examples and making them available in what we're calling a First Wins library, so that the countries can see not just the technical guidance, but they can see where other countries have actually done this, what challenges they've met, and how they've been able to make progress. And the community of practice is then also there in order to facilitate peer-to-peer learning and mutual support. And then just an example of the kinds of interventions that the countries are putting in place. As I've said, a very commonly requested intervention or implemented intervention now is climate-informed early warning surveillance and response systems for a range of climate-sensitive health impacts, but heat is one of the first ones that countries can get to terms with because it's a very direct impact. The science is very strong. The mechanisms are a little bit simpler than some of the other diseases. And so we now see a good amount of rollout of programs that support heat health early warning and action plans to respond. Initially, I would say in higher income countries, but now increasingly as well in low and middle income countries. So the last couple of things I wanted to cover are on the challenges that we continue to see in this space. I would say that over the years, as we have collectively developed the climate change and health field, there has been quite a lot of attention, and WHO has contributed to this, on describing the problem. And increasingly, we are saying for the most part, although we do need better evidence on impacts and so on, most people around the world recognize that climate change is real. It's having negative impacts on human health and well-being. And we want to increasingly put the focus onto solutions, because it's the solutions that actually empower people to do something about this, rather than just giving them increasing detail about what they should be scared of. One of the other challenges, as I've mentioned previously, is that climate change is a very cross-cutting issue. Climate change and health is at that junction between climate change and health. And sometimes these kinds of interface issues are neglected in terms of funding and so on, because they're harder to measure and to support than vertical issues. So that's one of the challenges that we're working to address. Finance is the most commonly requested need that we hear from countries. It's always a challenge, and ODA is shrinking, and for very bad reasons. So this is not a good decision that the world is taking to decrease development assistance, but it is the reality, unfortunately, that we're facing. And that last point is just making the point that because finance is small and shrinking, and also because of that siloing, we do have a particular problem of the financing falling between those two stools. So those are the challenges that I wanted to finish up with, but also to make clear that we have a lot of progress and a lot of good opportunities as well. So one of the things that we think is important is to have this focus on the solutions. So presenting a positive vision of what we want to see in the future, backed by practical interventions. We do think that we need to work in partnerships, but not just because it's nice to talk with everybody. We think these should be focused partnerships basically the smallest number of actors that are needed to get the job done in order to move forward. But in almost all cases, that is more than one agency. We also consider that particularly in this difficult funding environment, we should be focusing much more on assembling the evidence and making clear the investment case. And the evidence that is very strong that these are good investments, but not assuming that this will be picked up by development assistance. We wish it would be, and it should be, but irrespective of the funding environment, we need to present the evidence as to why this is a good deal for anybody to invest in. We think we need to work on, if not breaking those silos, then making bridges between those silos. And the final point is really ensuring that countries have ownership over their own plans, so that this is not seen as an external donor-driven agenda, that there is something that the countries themselves have developed, perhaps with the support of ourselves or others, but it is their plan. And then they should be able to pool support from a range of different sources in order to implement it. I think that's my final slide. So thank you very much for your attention. And back to you, Amy.
Thanks so much, Diarmaid, for this global overview and really setting the scene for the next presenters, which will be presenting some more kind of case study presentations. So I'm very pleased to introduce our next speaker, Carolyn Tateshi. She's the Director of the Climate Change and Health Office of Health Canada. Carolyn Tateshi oversees Canada's federal lead office on climate change and health issues and is a lead for the health and well-being system of Canada's national adaptation strategy. She works closely with many domestic and international partners on efforts to build climate resilient health systems. Thanks so much, Carolyn.
Thanks so much, Amy, and very pleased to be here with all of you. Thanks to everybody who's joined us from around the world. As mentioned, I'm Carolyn Tateshi, Director of the Climate Change and Health Office at Health Canada, which is Canada's national health ministry. Bonjour tout le monde, je suis Carolyn Tateshi, directrice du Bureau de changement climatique et de la santé à Santé Canada.
Repeating in French exactly what she said in English.
The unceded and traditional territories of the Algonquin Anishinaabe people and Canada's Indigenous population here in Canada. And we're pleased and privileged to live and work on this land here in Ottawa, Canada. So thanks very much, everybody. Next slide, please. I was going to give you a little bit of an overview to Canada's context and history in this area, talk a little bit about our experience with conducting national climate change and health assessments, talk about some of our experiences in working on addressing extreme heat as well as health system resilience, and then a few reflections on scaling up in the Canadian context. Next slide. So a little bit about Canada. So Canada is a large country spanning 3 different coasts. We are warming at about 2 times the global average rate, and our northern part of the country is warming at almost 3 times the global rate. So we are seeing a very broad range of impacts from climate change already, from floods to wildfires to extreme heat, severe storms, spread of vector-borne infectious diseases, mental health impacts, really a really wide range of impacts right across the board. And unfortunately, we're seeing these impacts increase in frequency and severity. And so the need to adapt in the Canadian context is quite urgent. In terms of how our country is organized, so Canada has a federated system of governance, and we're composed of 13 provinces and territories. Health is a shared responsibility between the federal and provincial territorial governments, with provinces and territories having the primary lead in terms of the delivery of health services to the populations. And the federal government plays an important role around specific areas where we have legislative or regulatory responsibilities, providing science, data, guidance, documents, and supporting a variety of action and communication and coordination across the country. So this provides some complexity in terms of building climate resilient health systems, because we have really 13 plus different types of health systems that we need to work together to coordinate and take action on. Within that, some of the provinces and territories have centralized systems of healthcare delivery, and so at the provincial level, they run that directly out of the provincial territorial governments. And in some provinces and territories, they also have devolved some responsibilities to the local or regional levels, and so we have a wide range of different kind of models, even within our different provinces and territories. So this creates a bit of complexity, but really we're facing a broad range of impacts, and we have a complexity within our governance structure in terms of how we take action within the climate and health space. Next slide. So Canada has been working on climate change and health-related issues for quite a long time. We've been examining climate change impacts, including on health, at least since the 1980s. At the time, we called it global warming, or had reports on weather and health. But over time, Health Canada created a dedicated climate change and health office, which has been in place since the late 1990s. And a lot of the early work focused primarily on understanding the health risks and projected impacts. And we did so in collaboration with many national as well as international partners. And the image you see on the right hand of the slide there is actually the copy of a report of the planning meeting for Ministries of Health to address climate change and health from 2002, which we collaborated with, I believe, the World Health Organization on that. So the work has been ongoing for quite a while to try to unpack the issue. However, a decade or so ago, or a couple decades ago, we started to take work to actually adapt to the impacts of climate change. And so since 2007, Health Canada has been working to take action to protect health from extreme heat and do things such as expanding heat alert response systems. And then we have also more recently been working to build climate resilient health systems across the board. Next slide. So as a part of this process, one of the important foundations was to understand, well, what is going to happen? What are the projection shows, and how is climate change impacting health? So a lot of the early work, as mentioned, was focused on trying to unpack these issues. And we have had a series of national assessment reports, some in collaboration with our environment and natural resources colleagues, which looked at a range of issues, and where there have been health and well-being chapters as a part of a broad range of intersectoral assessments. And then we have a couple of standalone health reports that we also produced in 2008, and then more recently in 2002. Next slide, please. So as a part of the process to develop our most recent National Climate Change and Health Assessment, we brought together over 80 authors from across the country, both within government and outside of government. We also engaged more than 100 Canadian and international expert peer reviewers as a part of the process, and also allowed for a public review of the document before finalization. And an important part was also a partnership with our National Collaborating Center on Indigenous Health to facilitate the integration of Indigenous knowledges, perspectives, and voices as a part of this process. And this very kind of broad collaborative process, I think, has been important for us to build a common understanding of what the impacts and issues and priorities might be as a result of the climate change impacts, and having benefited from the wealth of different voices and perspectives that people brought to bear to this, I think has allowed us to really provide a comprehensive look at what is happening. The most recent assessment that we did pick up on a number of sort of emerging themes, things like mental health, the impact on Indigenous populations, health equity, as well as adaptation and resilience. Next slide. And to guide our work, Canada's work is currently guided by our national adaptation strategy. And while we have been working on climate change related issues again now for decades, it was only in 2003 where we had a formalized national adaptation strategy, which really brought together perspectives from our provinces, territories, and partners from across the country to try to establish what is the strategy, what are our priorities, and where do we want to move forward collectively together. And we embarked on a multi-year process to develop this plan through a variety of different targeted engagements. We had expert advisory tables, including one specific to health and well-being, broad public and partner and stakeholder engagement, including at the time our health ministers directly engaging with some of our stakeholders to hear directly from them, and then release of the document for comment and finalization. Next slide. And so as a result of this process, we've built a what we call a whole of society roadmap for resilient Canada, and provides an overarching vision for resilience, which is that all of us living in Canada, our communities and our natural environment are resilient in the face of a changing climate. Our collective adaptation actions enhance our well-being and safety, promote justice, equity, reconciliation with Indigenous peoples, and secure a thriving natural environment and economy for future generations. And so it's really meant to bring together a whole of society approach, looking at different actions really across different sectors. There's 5 different systems within the National Adaptation Strategy, including health and well-being. And this is governed with a interdepartmental governance structure led by our colleagues at Environment and Climate Change Canada, and then working with ourselves on the health side, but also with colleagues from our infrastructure ministries responsible for natural resources, public safety, Indigenous populations, and environment, of course. Next slide. And as a part of this process, we established goals, objectives, and a few targets in this area. The 4 objectives, the first 2 really relate to the resilience of the health system and the knowledge, tools, and information and capacity that's required. The 3rd objective really talks about some of the urgent health risks, such as extreme heat, wildfire, smoke, infectious diseases, mental health, amongst others, that while we are building resilience in the health system across the board, we need to take action on certain risks. And then also the fact that we need to build climate action across all sectors and build and really support intersectoral collaboration so that health is integrated across a range of health adaptation issues. Next slide. So moving from the evidence and strategy to the action. So in 2018, we had launched a program called Health Adapt, which is a program to support the resilience of the health system across the country. And as mentioned, because we are a federated system and responsibilities are spanned across the country, we developed a program to support pilot projects across a wide variety of our provinces and territories, so 10 pilot projects at provincial level and some at the local regional levels, so to support them in building, undertaking vulnerability and adaptation assessments and working on adaptation plans, and in some cases taking early adaptation actions as well. This part of this program was in part inspired by the US program that they had on building resilience against climate effects, or BRACE. So we were grateful to our US colleagues who had shared information about their program at the time. And then we've also very much built on the thinking of the WHO's operational framework, which really helped lay the foundation for our thinking in terms of how our health system should be building resilience, and have developed tools and guidance, including a workbook in terms of how to undertake this work. And as a result of this, we've seen a lot of capacity really being built across the country, vulnerability and adaptation assessments having been developed, and in the process of currently launching the 2nd phase of this program with additional health authorities, with the goal of ultimately that really all of the provinces and territories and health authorities across the countries need to have assessed their risks at their levels and begin to take action. Next slide. A few of the lessons learned. So a lot of our program took place while the COVID-19 pandemic was undergoing. So it's no surprise that many of our partners had highlighted that that was part of the challenge in delivering their work, but they were very successful in continuing. And this is going to be a reality for, I think, work within the health sector. There was always going to be other competing priorities, and we are going to still have to move forward with building resilience to climate change impacts. Some of the enablers that we had highlighted, though, and coming out of this was having clear objectives, really the importance of engagement across a range of partners, integrating lessons from COVID-19, some advancements in terms of our data systems have been developed. Additional focus needed on prevention and preparedness for extreme weather events that we're seeing at a more rapid pace. And then really seeing adaptation as an iterative approach, as well as ensuring adequate staff capacity, which is always a challenge in the health component. And so there is a lessons learned report that is available on our website too, which goes into some of our lessons learned in a little bit more detail. Next slide. We've also been taking action around addressing extreme heat, developed guidance documents, working with our meteorological service on early warning systems and heat alerting systems. So we support, again, our other levels of government in terms of developing heat alert response systems to take action at the community level, and then also have developed a wide variety of promotional information materials for the public as well as for healthcare providers. Next slide. In addition, more recent work, we've been working to address a number of evidence gaps and addressing, in particular, indoor heat risks. So Canada is historically a cold country, and our housing and infrastructure is primarily designed to keep the cold out and keep the heat inside. But of course, in a warming climate, this poses a lot of challenges in the summertime when it heats up and our buildings essentially overheat. We had a significant event in 2021 where more than 619 people died, and 98% of those people died indoors. And so we see addressing this indoor heat risk as being an important part of our work going forward. A few quick reflections then in terms of our context about what has been successful and where we're seeing some challenges moving forward. So on the successful side, I think working with the willing, again, at the federal level, we don't have the ability to compel our partners to undertake this work. And so it's been important to work with those who have been willing and able and interested in working with us and can see the benefit in doing so. And by doing so, we're able to develop sort of models and leaders, and having certain parts of the country or certain leaders or regions being able to demonstrate how this work benefits their communities and how this work can be done has really, I think, helped inspire others see the path forward in terms of the work. So you don't necessarily need to do everything all at once, but starting with the people who are ready to start with you has been an important part of our approach. As well, collaboration and communities of practice. So as a part of our Health Adapt program, we had a formal community of practice and really supported the health authorities to work together, share information, and be able to learn and tackle challenges together. We have worked at identifying and addressing critical evidence gaps, so not everything that certainly exists, but ones where we see are real barriers to taking action. So in the heat space, really developing the evidence and creating sort of scientific consensus around which actions to take has been important to allow people the confidence and provide them the guidance and tools to be able to do so. I think also communicating what we were doing and being able to demonstrate the work that we do. So as a part of a Health Adapt program, we had developed digital case stories or videos where the communities talked themselves about their experience in undertaking the vulnerability and adaptation assessments and the work that they did and the importance for their communities. Those are available on our website, and that's been an important tool to help communicate what is this work, because sometimes it can be a little bit abstract, particularly talking to policymakers and decision makers about what is this work and what does it mean for communities. And so having the communities talk to and health authorities talk directly about their experience has been helpful. And then certainly working with other partners, so either in other sectors or internationally, has been really critically important. We have greatly benefited from our collaborations with the World Health Organization and PAHO and other partners over the many years. and are really privileged to be having joined ATTACH and be a part of the ATTACH initiative, which is also really giving us a lot of tools and information that are going to help our health authorities to adapt more quickly. And then I think then the other piece really is about openness, humility, and bravery to launch into this new space. A lot of times people within the health sector are used to being highly educated experts in the areas that we're working, and climate change can be a new space to move into. And we've noted that those who are successful at doing this are really take an approach of openness and really being willing to dive into new data, new approaches, and issues that we may not initially be experts at. And then, of course, the foundations of having done national assessments and undertaking prioritization approach. And then a few complexities and tensions that we noted too is just the need for evidence and data, but the need to take action. So we can't let that slow us down, but we need to still take evidence-based approaches. How we're building health system resilience versus addressing specific health issues such as extreme heat or other issues. The desire to want really coordinated action versus needing to take rapid action across a range of partners. And then, of course, resource constraints, be it financial or human resources versus the needs that we have, and not allowing that to be a barrier to what we need to be doing, as well as the ability to manage uncertainty as the climate continues to change and impacts are hitting us more quickly. And we're seeing also cascading and compounding events. And then also the question about who scales up in our context, because we have a complex governance approach. It's really important, I think, that we've taken the approach of all of us need to be scaling up at the levels and in the places that we need to be. So thanks very much again, a real privilege to be here, and I look forward to the other presentations. Thank you.
Thanks so much, Caroline. It was really interesting to hear about some of the complexities of Canada's governance system and how you've managed to address some of the challenges that this presents. And of course, Health Canada has been a long-standing technical partner of WHO and is really a leader in health adaptation. So there's a lot that we can learn from Canada's experience. And now we will move on to the next presenter, Yesenia Linares Vega. Yesenia holds a degree in meteorology and is a researcher at the Cuban Institute of Meteorology. She's currently pursuing a PhD in geographical sciences. Her research explores the links between climate change and health, with a particular emphasis on epidemiological surveillance and the prevention of vector-borne diseases under climate-related conditions. She currently coordinates the SAT-DENCLIM project, a pioneering community-based early warning system for dengue in Cuba that combines climatic and epidemiological variables to support public health decision-making. This initiative has fostered collaboration among scientific institutions, health authorities, and local communities, generating recognized adaptation practices of regional relevance. So I'm very excited to hear this presentation. Thank you, Yesenia.
Sí, buenas tardes, un saludo para todos
Good
nuevamente.
afternoon,
Gracias, Amy, por
everyone.
la
Thank
fabulosa
you so much for
presentación
the
sobre mi persona.
wonderful introduction,
Primero que
Amy.
todo, quería agradecer la
So first of
invitación
all, I would like to
para
thank
y que
you
nos
for the
permitieran brindar
invitation
nuestras
and for
modestas
you to allow
experiencias.
us
Como
to
bien
share
han
our
escuchado por los
experiences.
colegas que
And
me han
as you,
precedido y en sesiones
as I well
anteriores,
heard from
no
previous
cabe duda
colleagues and
sobre
from
el costo
previous
que las
sessions, there is
enfermedades
no doubt
infecciosas
of the cost
ocasionan a
of
las poblaciones
infectious
humanas. Como
diseases on
también
human
es ciencia
populations,
constituida
as
que el
well as
incremento de las
it's well-known
anomalías de la
science that the
variabilidad
increase
climática
in anomalies
condiciona
of
y favorecen la
climate change
proliferación de
also
vectores que
favors
transmiten
the
a virus, como
proliferation
por
of
ejemplo el dengue,
vectors
que es considerado
that, such as dengue, for
uno de
instance,
los
which
problemas
is
más
considered
serios
to
en
be
el
one
Norte de
of
las
the most
Américas y
serious
principalmente en
problem
el
in the
trópico, que
Americas,
comprende
especially
los
in the
países de
tropical
Centroamérica y
regions,
el
which
Caribe,
includes
los
countries in
cuales
Central
presentan
and
una mayor
and
vulnerabilidad.
Caribbean
Según
regions,
ante este
which
escenario, los
are
sistemas
more
de alerta
vulnerable.
temprana, ¿a qué
So,
me
given the
refiero? A
scenarios of early
remotamientos
warning
oportunos e
systems,
inteligentes para
this is
proteger las
a
vidas y proteger
timely tool
recursos.
to
Y
protect
por
the
tanto, el propósito
populations,
de mi
to
presentación
optimize
es
resources. And
mostrar
the
a partir
purpose
de
of
un
my
caso de estudio
presentation
desarrollado
is to
bajo el
use a
Proyecto
case
Sorrento,
study
el cual
developed under
constituye por
the
sí mismo una acción de
SAT-DENCLIM
adaptación
project,
proactiva
which
en
includes
respuesta a
a
las
early warning system for dengue virus and the changing climate conditions, which is very much linked to the visible impact of climate change in our countries. The project, as you can see there, it's early warning system for dengue virus and its climate sensitive transmitter vectors with an action community. Next slide, please. Well, this project had the objective of implementing an early warning system for the circulation of dengue virus and to increase adaptation of communities associated to climate variability and change. Within the project, we drafted specific objectives, which included, you can then read in more detail the objectives, the specific objectives and the results. Next slide. So regarding the next slide, please. So in the pilot area selected, Old Havana is one of the most vulnerable areas in this province, which presents a very low geographical area and flooding because of heavy rain. It's a highly populated area with a high risk of overcrowding, elderly population with unfavorable health conditions which promotes the proliferation of dengue and makes this population very vulnerable. And it was selected to implement this project. Next slide. So this is a organizational chart of the work, well, how it's organized for the early warning system of dengue, which is participatory, that was designed and implemented. And as you can see there, it has the different components with the meteorological organization at international level in the health system. So it includes monitoring, detection, and diagnosis of information coming from vigilance, surveillance systems on climate change, entomological and epidemiological, and it also includes environmental information as well as socioeconomical one. Then we do we integrate the data which are available in the area through the UTOP methodology, and we create diagnosis, prospects, and predictions through flyers that we prepare, which are designed based on the characteristics of our target groups that we've identified, such as decision makers, policy makers, and populations with the most vulnerable, such as the elderly, women, and children, who are the most vulnerable ones and who are the most at risk in these cases, so that the community and all these stakeholders can actually interpret the alert systems and respond accordingly. We also drafted a community strategy that supports based on the public education methodology, which contains a program educational and awareness raising program was developed for these stakeholders.
Next slide, please. Okay. And here we have some characteristics of that early alert system. It was created based on the UTOP methodology, which gives us a flexible framework for both space and time. There's also a hybrid approach to include the geography of health with a quantitative methods, because we have information with different metrics, and so we can assess the effects of the weather on different variables, and it is very user-friendly. It uses colored light system, and it shows it has limitations, of course, like any other tool. And this methodology, this Bulldog methodology, was useful for us, but it requires a comprehensive approach combining health, climate, and the vector. Next slide, please.
Bueno, aquí a continuación se muestran algunos de los
Here
resultados,
we have
resultados o
some of the
bondades del sistema
results
que permite
of some of
visibilizar
the
el
benefits
comportamiento,
of this
tanto
system
longitudinalmente
that
como
allows us
espacial,
to
lo que
view
evidentemente apoya los análisis posteriores y los
behaviors
posibles
both
predictores que alimentan el
longitudinally
modelo,
and in a
como por
spatial
ejemplo
manner.
determinar los patrones
So
temporales
we
o
can
espaciales, sus
determine time and
variaciones,
space
sus
patterns,
tendencias, ciclos
variations,
de la
trends,
ciclicidad de los indicadores, la
cycles,
próxima.
because these
De
indicators
igual
are
manera,
cyclical.
se
And
realizaron,
next,
la próxima.
please.
De igual manera, se
Next slide,
realizaron
please. And we also
algunos análisis
did
para
some
determinar el nivel de
analysis to
asociación
determine
espacial del clima en el
the
dengue, el efecto acumulativo o
link
desde tarde,
between
así como identificar condiciones
climate
de riesgo y
and
cuáles son las áreas
dengue.
de puntos calientes donde se
What are
presenta el
the
mayor
hot
riesgo de transmisión
spots
para los próximos
where
meses,
the
favoreciendo
risk for
así las
transmission is
acciones
higher for
preventivas y
the next few
focalizadas y no
months in
continuar
order to
dando
have
respuesta
focalized
dando
preventive
respuestas
actions
reactivas a las situaciones
instead
preventivas,
of
sino desde un
giving
enfoque
reactive
proactivo.
response.
La
You
próxima,
know, this allowed
también
us to change to
aquí
a
se muestran
proactive
algunos
approach.
productos
Next,
más
please.
relevantes que da la próxima, que da el sistema de
Here we have
desarrollo, que
some
da la
of
salida del
the
sistema de alerta
output
temprana,
of
es decir,
this
los boletines
early
con
alert
los
system. We
pronósticos
have the
con una frecuencia,
newsletters
se
with
emiten con
the
una frecuencia
forecasts
mensual y
that
contienen
are
pronósticos
issued
mensuales y
monthly,
trimestrales.
and
Y es
the
uno va
forecasts are
dirigido a los
monthly
tomadores de
and
decisión, un boletín técnico
for 3
dirigido a los
months as
tomadores de
well. One
decisión,
of them
y otro
is
más,
for
más
decision makers,
simplificado, más
and there's a
enfocado a
simplified one
características de la población y
that
que
is
incluyen
adapted
además
for the
recomendaciones, medidas
population in general, and it includes
medidas
recommendations
para realizar en los hogares que no
of things that
gastos
people can do
económicos
in
y que
their
así
homes that
favorezcan la
don't
reducción de
cost
casos
money
y ahorro de
and that
recursos en los
will
sistemas de salud.
help in
La
preventing
próxima.
cases. Next, please.
Bueno, también es importante
We
tener claro que no basta solo con tener
also
un sistema de alerta operativo.
need
El
to
sistema
remember
también
that you don't just
incorporó
need
fases estructuradas de
an
trabajo
alert system
comunitario
that is
que incluyeron la
operational.
evaluación,
We
encuestas
also had
comunitarias
community
en varios
work,
periodos,
assessments,
inicial, un
surveys
intermedio,
at
una
different
final,
points in time,
para conocer las percepciones de
at the
riesgo, hábitos de
beginning,
prevención,
during the process,
necesidades
and
de
at the end,
información, vías de
to
comunicación
learn
factibles
about the
y bueno,
needs
la
for
evaluación entre
information, what
ámbitos comunitarios,
communication
lo que
channels
evidentemente
were
favoreció el
feasible,
diseño
and
también de
also to
materiales
empower the
educativos, además
community.
de realizar
This
simulacros de alerta y
favored
respuestas
the
integradas.
work on the
La
creation and
próxima,
education materials. Next, please.
la próxima. Bueno, aquí se muestran algunos
Here
ejemplos de
we
materiales
have
educativos y
some
comunicativos
of the
diseñados y
educational and
adaptados a los grupos
communication
meta que
materials
versan acerca de la
that
importancia
are
del clima
specifically
sobre dengue y
targeted
su
to
vector
our
y
target
refuerzan las
groups
medidas de
about
prevención, lo
dengue
que
and
evidentemente
the
favoreció la
vector
comprensión y
mosquito. And this
involucramiento de la población por
helps
parte
people
del sistema de
get
alerta temprana. Se
involved.
desarrollaron
This early alert system.
materiales,
We
pegarias,
had these
dibujos y otros recursos útiles
folded
para los niños
materials, and there were some other resources
La
for
próxima.
children. Next, please.
Bueno, dentro de las diversas actividades
Then
de
among the
formación,
different
capacitación y
training
sensibilización con la
activities,
comunidad,
awareness activities we
se
did
realizaron
with the
talleres
community,
técnicos para grupos
there were some
transdisciplinarios, se
technical
realizaron
workshops
talleres de formación de promotores en clima y
to
salud, tanto en
train
niños como en
health
adultos, como
and climate
adultos,
promoters,
como adultos
both
mayores.
aimed
Se
at
realizaron charlas
children and
comunitarias, se
grown-ups
realizaron festivales
with the elderly
educativos
as
y
well. There were
concursos tanto para
some
niños como para
festivals,
adultos.
some
Se
contests,
mantuvo
both
una
for
constante
children and
retroalimentación con los grupos
adults,
focales de la
and there
comunidad,
was
principalmente
constant feedback
con
with
estos
the
grupos en
focal
condición de
groups in the
vulnerabilidad,
community, especially those
con el propósito de
where there were
mejorar la
vulnerable
capacidad de respuesta
populations, with the aim
ante cada
of
situación
improving the
y poder
ability
también
to
su capacidad de
respond
adaptación, el
to a
manejo y
situation
la
and
gestión del
improve
riesgo asociado a los
their
problemas climáticos y al riesgo
adaptation
de dengue.
abilities
Y bueno,
and
también se
reducing the
realizaron
risk
detenciones
of them
organizadas entre
contracting
las
dengue.
instituciones y los
And there were
vecinos, porque
also
evidentemente
some
es una
actions
responsabilidad
between
compartida
authorities
institucional.
and the
Y los
neighborhood,
vecinos
because
que
it's a shared
propiciaran
responsibility
reducir los impactos
for, and so
del
the
clima y las
population
condiciones
needs
favorables
to
pronosticadas para el aumento de
also
las
become
poblaciones de
involved
vectores por
in
el riesgo
reducing
un mayor riesgo de,
the
de
conditions
transmisión del
that
dengue.
make it so
La
the
próxima.
mosquito spreads. Next, please.
Y bueno, evidentemente, como toda
And of
acción
course, just
climática o
like in any
iniciativa,
climate
presenta
action or
desafíos. Se
initiative,
convirtieron en lecciones
we
aprendidas.
have
Y les
challenges that
muestro algunos de
became
esos desafíos
lessons
encontrados
learned.
en
And
las
here I show
recomendaciones que
you some
generaron
of
el
those.
desarrollo
and the recommendations that came out of this pilot project. As I mentioned before, it's a proactive and anticipatory adaptation measure to face with the increases in temperature and the spreading of the vector. And we found that we need a high degree of empathy to work and involve the population. And also in an early alert system is not just a technical tool, but it's also an instrument for governance and health education. It requires science, institutional coordination. It also requires active participation from the population. So it was really a huge lesson. And as a pilot project, it's important to remember that it's not just enough to have one pilot project, but we need to ensure sustainability. And a project such as this one also requires resources, funding, and a transdisciplinary team. Next, please. And here to close, and to finish my presentation, here is a picture of most of the members of the transdisciplinary group with health workers, climatologists, authorities, and leaders of the social projects in the community, and some government officials. We even involved the mayor of that community from the beginning. And in that way, we not only make sure we have the operational work, but also the community becomes actively involved. And on behalf of this group, I would like to thank the Inter-American Institute for Research for Global Change and the Pan American Health Organization, and in particular its office in Havana, for their support. Without them, we wouldn't have been able to implement this project. And thank you to the organizers for giving me the opportunity to show our experience. And I am here if you have any questions. I also leave you my email in the bottom in that slide for any questions. Thank you. Thank you so much, Yesenia.
Straight to the next speaker. So I'm really pleased to introduce Berta Luz Pineda Restrepo. Berta is a sociologist specializing in sustainable development, environmental management, interculturality, and migration. She holds a master's degree in social project and program management and a higher diploma in international health policies and health sovereignty. She's held a variety of roles in government and academia, including at the Colombian Ministry of Health, the Universidad del Valle, and the National Secretariat for Migrants in Madrid, Spain. She's now been working for 10 years with the Andean Health Organization and the Hipólito I can't pronounce this. You might have to pronounce that for me, agreement in Lima, Peru, where she coordinates climate change and inequalities. She's an active member of the Colombian Public Health Association and the People's Health Movement. Thank you, Berta.
Sí, muy buenas tardes, apreciada Amy.
Good
Muy buenas tardes para
afternoon.
todos y
Thank
para
you,
todas, y muchas
Amy.
gracias
Thank
por
you.
la
Good
invitación.
afternoon, everyone. Thank you
Mucha
for
alegría también
having me
comentar
today.
la presentación
I
de
am
hoy.
very
Queremos
happy
hacer
to
énfasis
share my
en la
presentation
sistematización y
today,
evaluación del
and
Plan
we would
Andino de
like to
Salud y Cambio
emphasize
Climático.
the
Como lo decía Amy,
systematization
yo trabajo con el
from
Organismo
this
Andino de Salud, que es una
Andean
entidad
health plan. As
intergubernamental
Amy said, I
que
work in
integra
the
6 países
Andean
andinos:
Health
Bolivia, Chile,
Organization
Colombia,
that
Ecuador, Perú y Venezuela. Un saludo muy
includes
especial de
6
parte de todo nuestro equipo.
countries:
La
Brazil,
región del Organismo
Colombia,
Andino de Salud
Chile,
es en el
Ecuador,
2030 los
Peru,
habitantes
and
de la región andina
Venezuela.
gozan del derecho a la
And
salud y al
uh,
bienestar. Las
the
desigualdades se han
vision
reducido y hay
for
una mayor
this is
capacidad de
that in
respuesta conjunta
2030,
a los
the people
desafíos
living in the
sanitarios,
Andean region
socioeconómicos y
will
ambientales
be
a través
enjoying
de
the
la
right to health
integración
and
y la
well-being.
cooperación
Inequalities
regional. En
will
mi
have been
presentación he
reduced,
venido
and there
dando
will be
mucho
a
énfasis
better
en la
ability to
importancia de la
jointly
integración y
respond
la
to health,
cooperación
socioeconomic,
regional.
and
Les decía
environmental
también en
challenges
la
through
presentación anterior,
regional
en el segundo
integration and
paso, que el
cooperation.
Organismo Andino de Salud
And so the Andean Agency of Health works for the health of 173 million people, and we work with 35 instances of regional integration that are all following some priorities and coordinated by the ministries of health. And we also work with some partner bodies. One of the committees that I work in, whose work I'm going to present, is the Andean Committee for Risk Management for Climate Change and Disasters. Since 2019, it is led by climate change coordinators from the ministries of health of all 6 countries. And what I want to stress is that the Sustainable Development Goals are the ethical map guiding our work. Climate change cuts across the 17 SDGs. It impacts poverty, hunger, health, inequalities, and even peace. So decidedly tackling these issues is so important. The recent report on the SDGs shows an assessment of the progress made, just 5 years away of the deadline set that was for 2030. The world is very far away from reaching those goals. 35% of the goals are on the way or showing moderate progress. Almost half showed a slow or marginal progress, while 18% have regressed. And the report demands action on 6 priority areas: climate and biodiversity, employment and social protection, food systems, access to energy, digital transformation, and educational reform. Achieving health requires acting decidedly towards each of the SDGs. Facing the climate crisis is one way to protect life and a step towards reaching the SDGs. And reaching those is an ethical commitment with the newer generations. The 6 countries in the Andes have these persistent challenges, and we need to increase the speed of the changes. If what you see in green, it means that we have reached the goal, and we only have 1 cell painted green. So this means that we still have a long way to go. In red, it means we are still far from reaching that goal. And all of the goals are related in one way or another to health. And I was just saying, climate change impacts all of them in one way or another. But I'm going to focus on goal number 3, which has to do with well-being. And just as an example, I also took some data from the WHO's more recent report on the SDGs. And in this example, we see that between 2000 and 2019, life expectancy increased by 5.4 years worldwide, but the COVID pandemic reverted almost a decade of progress. And life expectancy at birth, it varies among countries in the Andes, as you can see in the graphic. And we also have the healthy life expectancy, which represents the years we live with good health, and it's lower than life expectancy. Climate change reduces both life expectancy and healthy life expectancy. And so we need public policies that will promote an increase in the years we live with good health. Speaking of the challenges of the SDGs in the Andean region and in Latin America in general, the last report from the Economic Commission of Latin America shows us that the transition to a lower carbon and more sustainable economy requires a structural and productive transformation. And we can analyze that based on four components: a good governance, technical, political, and prospective capacities of the institutions in charge of every transformation, the space for social dialogue, a political economy associated to each of these reforms. And as I was saying, it's essential to move forward and make progress with SDGs because health faced with climate change demands collective courage. There are many motivational messages, but this shows us the urgency that we have to make peace with nature. We need a deep transformation of financial, economic, and productive systems. We urgently need to break with the current trends of the environmental destruction. The transformation of humans' relationship with nature is key to achieve a sustainable future. The time to act is now. And in the session in October 9th, I spoke of climate change, of the results we expected, and the actions that have been carried out. All of this in the context of some regional work with a process of social participation. And I'm not going to go deep into that, but I will stress the significance they have and how important it is to systematize our experiences and to assess them. And we need to do this in a participatory approach. This is our analysis of our experience that allows us to find lessons learned and issue recommendations that we also need to share with others so that they don't make the same mistakes. Learning from the practice to improve is essential, and we need to be very open to reflect on it. Assessments allow us to analyze the results we obtain, to identify progress and also gaps. And we need to leave aside our egos and this myth of everything is fine and we are successful. We need to focus on results, and this will improve informed decision making and promote transparency. For us, assessments are key, not just to make a new version of the Andean Plan, which expires this year, but also will ensure that the actions respond to the reality. Assessments are not just technical, it's also ethical and political. And I would like to briefly go over the assessment done last year. I see I don't have much time. I won't be able to go into detail about the indicators, but you will have the presentation later.
En naranja, aquellos que todavía tenemos aspectos claves por mejorar. Y en rojo, aquellos que
And in
todavía
red, there are
nos
those
falta
that
muchísimo trabajo
where we
para
still
lograr lo
have
propuesto.
much
El
work
plan
to be
andino
done for
de
us
cambio
to
climático
accomplish what we
tiene
planned. The Andean
56
Plan on Climate
indicadores.
Change
Nosotros
includes
decidimos
56
para la
indicators,
evaluación
and we
agruparlos
decided for
con
the
los miembros del
assessment to
comité.
group
El año
them with
pasado
the
se
committee members
seleccionaron
last year.
12
We
indicadores
selected
claves.
12
Algunos de ellos son
indicators,
los
key
siguientes:
indicators. Some of them are
porcentaje
the
de
following:
dependencias
the
que el
percentage
Ministerio de
of
Salud coordina con el
dependencies of
SIDA. Ya se
the
habrán
Ministry of
imaginado la
Health
importancia que
coordinated
tiene
amongst
que
themselves. So you
coordinemos
can
entre
imagine the
nosotros
importance of
y que realizan
coordination amongst
funciones
ourselves,
de manera
and that they
coordinada para
undertake
enfrentar
different
el cambio
roles in a
climático.
coordinated
Otro
fashion to
indicador
address climate
modelo de
change.
países
The other
días,
indicator is
pero
the
que las
number of Andean
prioridades
countries that
decididas
manage for
relacionadas
health
con el
priorities
cambio
related
climático
to
se encuentren en los
climate change
documentos oficiales
be found
enviados
in
a la
official
Convención
documents
Marco de las
sent
Naciones
to the
Unidas
Framework
sobre el
Convention
Cambio
of the United
Climático.
Nations on
Número de
climate
países
change.
con
Then the
comisiones,
number of
comités
countries
o
with commissions,
equivalentes,
committees, or
sobre
similar
todo que
structures,
haya posibilidad de
especially
trabajo
uh,
intersectorial con la
that do
participación del
intersectorial
Ministerio de
work with
Salud.
the
Número de
participation of
criterios de
the Ministry
trabajo
of Health, and the
intersectorial
number of
cumplidos
uh,
por países andinos
intersectorial work
para la gestión
accomplished
del
in
cambio
Andean
climático
countries
y
for
porcentaje de
management of
países
climate
que
change and
impulsan
health, and the
establecimientos
percentage
de
of
salud
countries that
sostenible, por ejemplo,
promote
base en medición de
establishing
huella de carbono o acciones
sustainable
para su
health measures,
reducción.
such
Estos
as
son algunos de
measuring
los
the carbon
indicadores. No voy
footprint
a poder
and others. So
comentarlos ni
these are some of the
explicarlos por el
indicators. I am
tiempo,
not able
pero
to address
ustedes
all of
quedan
them
con mis
because of
datos
time
para
constraints,
poder
but
luego
with this
hablar un poco más del
data, we
tema.
will then be able to
Acá ustedes
discuss
ven de
further.
manera gráfica
So
los
here,
indicadores que
to
tenemos
do this a
en
bit
verde,
graphic,
en
we have some
amarillo
of
y
the
en rojo y
indicators
también los
in
resultados
green,
por país
red,
y acá
and
el
yellow, and
desempeño por
in
país
by
y el
per
alcance
country,
global que hemos
as well as
alcanzado
the
del
global reach that we've
56%
managed
de
of
ejecución y cumplimiento
56%
de las
of
acciones planes
implementation
indicadas
of
propuestas.
actions
Cuando
and
hablamos
the
de las
indicators that were
categorías
suggested.
para
When we
poder
talk about
mejorar
the
el
categories
desempeño,
so
los
that we can
miembros del
improve the
Comité
performance, the
Andino y
members of
delegados de
the
los 6 países
Andean
encontraron
Commission and the
desafíos
delegates
claves
of
y
the
ustedes
countries
encuentran acá
have
la
found
diferencia por
key
país
challenges, and you
en
can see the
respecto
differences here
a
per country.
cuáles son aquellas
Regarding
categorías
those
fundamentales para
categories
poder mejorar el
that are
desempeño
essential to
global
improve the
de los indicadores
performance at
trazadores,
global
hemos
level of
agrupado
the
en 4. En
suggested
primer
indicators. We have
lugar,
grouped
pueden ver
4
ustedes
of them.
allí las
First,
políticas,
you can see
la
policies,
normatividad, el financiamiento, los
regulations,
recursos humanos. Cuando les
resources,
pedimos que
human
prioricen aquellas
resources, financing and
soluciones que
human
debemos
resources. When we ask
enfatizar
them
y
to
señalar con
prioritize
mayor
the
fuerza,
solutions where we
en primer
should
lugar aparecen
place
las
emphasis
políticas,
on,
en
we
segundo lugar el
first see policies,
financiamiento, luego
second
los
place
recursos
financing,
humanos y la
then
normatividad.
human
Ya
resources,
voy
and
a
finally
terminar
regulation.
diciéndoles lo
I'm almost
siguiente en
done
relación con las
by
conclusiones.
sharing as a conclusion the
Tenemos
following.
importantes desafíos. La necesidad de
We
un mayor
have
respaldo político
major
para
challenges
fortalecer las
of
capacidades de los
more
recursos humanos
political
y
support needed,
tecnológicos para el
and to
trabajo
reinforce
en todo el
human
país
and
y
technological
especialmente en las zonas de
resources for all the
frontera,
work across
para
the
también
country,
tener
especially
indicadores
in border
regionales
regions. So we can
que
also
nos
have
permitan
regional
analizar
indicators
de
that will
manera
allow us to
regional con
analyze
indicadores
at
homogéneos
regional
la
level and
vulnerabilidad y la
homogeneous through
adaptación, la
homogeneous
resiliencia, la
indicators, the
sostenibilidad y
vulnerability,
los beneficios de las
adaptation,
políticas en
resilience, and
cambio climático en
sustainability, and
países.
benefits
Las
of
principales
climate change
soluciones
policies
propuestas
in health.
están
The
enmarcadas en
main
decisiones
solutions that are put
políticas
forward
para
are
fortalecer la
framed in political
coordinación
decisions to
intersectorial y como
strengthen
marco
intersectorial
conceptual, la
coordination and
justicia
as a
climática,
conceptual
la
framework
gobernanza
of climate
participativa,
justice,
reducir desigualdades, promover
participatory governance,
participación activa,
reducing
derechos
inequalities,
humanos y
more
la
active
naturaleza también.
participation,
Por otro
human
lado,
rights,
es
and
importante
nature.
mencionar que para
On the
nosotros,
other
en
hand,
este
it's
momento,
important
en
to
el
mention as well that
2025,
for us,
hemos
right
retomado
now in
para terminar la
2025,
evaluación y
we've
hacer una
resumed
nueva
the
revisión
assessment.
del plan
So
andino
we
de
are
desarrollo
planning
y
on
cambio
doing a new
climático con
Andean
la
plan on health and
cooperación
climate
de
change with
organizaciones
the
como la
support
Organización
of
Panamericana de la
organizations
Salud,
such as the
entre otras,
Pan
y el
American
rol
Health
protagónico de los
Organization,
delegados de los
and
ministerios de
also the
salud de los
protagonist
6 países
roles of the
andinos. Es
ministries of
inspiración para
health of the
nosotros
Andean
y el plan
countries.
debe
This
ser
is
compatible
inspiration,
con el
and this
plan de
plan
acción
should be
mundial sobre el
shareable
cambio
and
climático y
aligned
salud
with the
liderado por
national
la OMS
international
y el
action
plan de
plan
acción de salud de
of
Berlín
of
liderado por el
Berlin,
Ministerio de Salud.
led
Quiero
by the Ministry of
invitarles muy
Health.
cordialmente
So I would
a
like
la
to invite
presentación del
you to
informe
uh,
de
the
las promesas de
presentation of
acción
the
climática y
report on the
alternativa para un
promises,
futuro
pledges
próspero en
for
el sentido de
a
los
more
desafíos que
prosperous
tenemos que
future
poder
regarding the
mejorar
challenges that
y
lie
dar
ahead
respuesta
in
a indicadores
improving
claves de salud. Y
the
un mensaje final
response
para terminar.
to
Una sociedad
health
que
issues
cuida
and
la vida
climate change, as well as
reconoce
the
la salud
indicators. And
como un
finally, a
derecho
final message:
inseparable
a
del entorno que
society that
habitamos. Solo mediante el diálogo
safeguards
entre
life,
saberes, la
recognizes health as
construcción
an
colectiva de
inseparable right from the
alternativas
environment in
frente a
which
las
we live
causas
in. Only through
estructurales de los
dialogue
problemas,
between
la
those who
integración
have
regional
knowledge,
y la
collective
cooperación
construction of
solidaria
alternatives
podremos dar
for facing
respuestas
structural
sostenibles
causes
y
of
justas
problems,
ante los desafíos
regional
que nos
integration
espera
and
el
solidarity
momento de
cooperation
actuar
we
que se
can only
valore,
then
sistematizar
provide
nuestras
sustainable
experiencias y
responses. The
evaluar lo que
moment to act
hacemos
is
no es
now.
un
We need to
ejercicio
systematize our
solamente
experiences and
teórico,
assess what
sino
we do,
una
not just as a
herramienta
technical
real para
exercise,
aprender
but
de la
as a
práctica,
vital tool to
corregir
learn
el
from
rumbo y
practice,
potenciar el
correct
impacto. Y
the
solo
way
así
forward,
podremos
and
avanzar
boost
hacia mejores
impact.
resultados
Only
en
in
el
this
cuidado
way
de la
could we
vida
move
y una
forward
vida
towards
digna
better
para
results
todos y
in
todas,
safeguarding
porque
life
juntos
and a
son más
better world
fuertes
for
que juntos
everyone,
tengamos
because
más lejos.
together we're
Muchas
stronger,
gracias.
together we get
Muchas
farther.
gracias,
Thank you
Berta.
very
Very
much.
inspiring words,
Thank you
words to
very
finish on. So we have very little time for Q&A, so we're going to do a speed round, one question per presenter, and I ask the speakers to please keep the answers to less than 1 minute. So we'll start with Diarmid. Now, of course, we know that health is very underfunded in the climate space, so we have a question around what are the processes that WHO has to help LMICs access climate finance?
Yes, thanks. I would say there are two kinds of processes. One is that you are able to basically contact us either through the WHO country office or through our regional office or headquarters to provide you the guidance on that function. So we have guidance, for example, on accessing the Green Climate Fund or preparing an application for the adaptation fund and so on. So we are able to both provide contacts and also sort of the actual process guidance on how to go about this. But I would say the approach to the WHO office is at any of those levels is probably the most important advice I can give. Back to you, Amy.
Thanks so much. And then over to Carolyn. So one of the participants said that they're facing some challenges in connecting civil society with the various working groups. And we're asking what are some of the channels for connecting and presenting work projects at the regional level in a country?
I guess we've taken different approaches. One is that we've developed communities of practice, which allowed bringing together a wide range of partners to share information as a part of our national assessment process. Again, we had expert advisory tables, which included some civil society representatives on them to allow them to share their views as well. So I think I would say in general, it's about bringing in those who are interested and willing to work together and trying to find structured mechanisms, whether they're communities of practice or expert advisory tables or different types of engagement opportunities that will bring people in and allow people to organize. And also working through existing networks. So if there are civil society networks that already exist, then that might be also a channel in. Again, we worked with different organizations such as our National Collaborating Center on Indigenous Health, which provides networks into different Indigenous populations. So networks can also be a place to tap into. Thanks.
Thanks so much, Carolyn. And now Yesenia. One of the participants has asked, how can data transfer between the epidemiology and meteorological departments be improved to make predictions about dengue outbreaks? They say that sometimes local data is lacking and satellite data must be accessed. Yesenia, did you catch the question, the interpretation, or would you like me to repeat? You're on mute if you're trying to speak.
Sí, por favor, repítela.
Yes, could
Okay.
you please repeat the
So one of the
question?
participants has asked how data transfer between the epidemiology and meteorological departments could be improved to make predictions about dengue outbreaks, because often local data is lacking and satellite data must be accessed.
Bueno, lo primero que se debe tener claro
Well, the
es
first thing that
lograr
should be clear is that we
acuerdos entre las
should have
instituciones para
an
garantizar el
agreement
flujo de la
between
información.
institutions to ensure
Y
the
lo
flow
segundo
of
es
information.
que se
And
debe tener
secondly, is that we need to have, there is no
You're on
input.
mute, sorry. Yesenia, I don't know if you're able to unmute. Maybe we'll move on to Bertha and then we'll come back to you. Oh, okay, you're unmuted.
Sí,
Please go
disculpa,
ahead.
es que cada cosa está en
Yes,
un lugar
sorry.
diferente. Bueno,
Um,
como decía,
as I was
para poder
saying,
lograr la integración de esa
to
información y
manage
garantizar
integration
ese
of this
flujo de información
information
que
and ensure this
sistemáticamente
flow of
se
information that is
proveen de esas
systematically
instituciones son los acuerdos
provided
para
through these
garantizar ese
institutions are
flujo y
agreements in order to
posteriormente
ensure this
que
flow.
esta información que recoge el
And
microclima de
secondly, the
del
information that
área, de la comunidad,
uh,
la información
from the
antropológica y
community,
arqueológica.
microclimate,
Acá en Cuba
and meteorological departments. Here
una
in Cuba, we
vigilancia muy
have
robusta para
a
tener ya
robust
esa
surveillance that
información
allows us to
que
have that
se realiza
information already,
sistemáticamente, por lo tanto
that
no
is
tenemos
done
grandes problemas para
systematically. Therefore, we
buscar
don't
la
have
información,
much,
la tenemos
many
bien
challenges in
robusta y
accessing
eso nos
information. It's quite
facilita
robust, and this
lograr,
facility makes it easier
bueno, pues integrarlos a la plataforma para
to
lograr esa
integrate this
malla
into the
que
platform
realizamos
so that
para
we can
homogeneizar
create
esas
this
métricas. Por lo
network and
tanto,
also
eso
make
facilita
the
mucho la
metrics more
integración y
homogeneous. And this
la
facilitates
sistematicidad
integration and
en los
the
servicios
systematic
que se
method
emiten
of
a través del sistema de
services
alerta
that are
temporal, que aún
issued
por
through
el
the early
periodo
warning
último,
systems.
pues se
And even when
continúa
the
realizando
project
y
was
todos los
ended,
días.
this was still done.
Muchas gracias, Yesenia. And finally, Bertha. So you get the last and the easiest question. Not really. What, in your opinion, would be the most urgent action the health sector should take in the coming years to address climate change?
Bueno, fortalecer las capacidades
Well, to strengthen
técnicas y
the
también
capabilities
políticas,
both at technical
como
and
dice
political
el
levels,
informe
as
municipal
the
y otros,
report
y tener siempre como
from
marco
ICLAC says and
directivo
others, we should
primero la
always have a
sostenibilidad y
directory
desarrollo
framework,
sostenible,
the
siempre con un
fulfillment of sustainable
enfoque de
development goals,
lograr mayor
always
igualdad,
with an
de mayor
approach of
ejercicio de
increasing more
derechos para todas
equality
las personas
and
sin
exercise
dejar
of
a
rights
nadie
for
atrás.
all people without
Gracias.
leaving anyone
Muchas
behind.
gracias.
Thank you.
Now, I wish we had more time to ask more questions. We have lots of questions for the presenters, but we are out of time. So I would like to give a very big thanks to all the presenters and, of course, to you, all of the participants, for your attention and your engagement. We look forward to seeing you at the next session, where we'll look at how to ensure that no one is left behind in our efforts to scale up health adaptation. So thank you, everyone, and have a wonderful day or evening wherever you are.